Hello everyone, this is Alraies from CVI 2022 in Denver, Colorado. I'm really privileged to be with Dr. Mehdi Shishehbor. He is a co-director of the Cardiovascular Innovation, and also he's the president of Cardiovascular at University Hospitals in Cleveland, Ohio. Mehdi, always pleasure to see you, and thanks for putting all this together with the team.
Thank you. It's our pleasure. It's really an honor to be here. As you know, education is very dear to our hearts, and the opportunity to be here and to be back in person is special.
Absolutely. One of the biggest vision of this program, and it's stated in the name, cardiovascular innovation.
Right.
And innovation requires time, thinking, investment, finance, and COVID came, and you're still going as a cardiovascular innovation. So what is your vision before COVID, after COVID, and what are the challenges?
Yeah, Chadi, the pandemic obviously had a lot of negatives, but I think it also gave us an opportunity to step back, be a little bit thoughtful, and think about how we want to move forward. I think we always want to be obviously innovative, and we're going to continue to emphasize innovation as part of cardiovascular innovations.
Right.
But we want to be able to invest in the next generation. This meeting has always been about early career, our fellows, early career individuals, our ability to interact with each other and build relationship in the hallways, here in the exhibit hall.
Absolutely.
And in the rooms. The most important thing I think for a meeting like this and the opportunity is that we really need to understand what the next generation is going through and what are the gaps and how we can help them through these meetings. I'll give you an example. For example, as you know now, I'm a little bit more on the administrative side of medicine. And I've understood and learned the gaps that are there in knowledge for physicians as they pursue their career. You can't any longer separate the administrative, the business side of medicine from the clinical side.
Yeah.
And I am hoping that as we move on to next year, we can bring some of that to CVI.
Right.
Bring the business of medicine to CVI, be able to educate our young generation, our early career folks, so that they understand the business of medicine. We also want to address physician burnout. This has been huge for me, and I think that the pandemic really escalated this. The physicians don't feel they're empowered. They feel that they have been disempowered. And we need to teach, and we need to, in these meetings, bring physicians together, bring the early career individuals together, and identify pathways where we can elevate, give power back to the physicians, and have a more control of their destiny, of their practice, and what they want to do with their careers.
Yeah. So you touched on a very important aspect, which is the business aspect of medicine and innovation. For us as physicians, we have no idea, no clue. We just focus on doing the job, taking care of the patient, go home. But all of a sudden, we wake up in 5-10 years in our career, said, oh, what am I now? I'm just like a robot. So this is a very important topic. And what if you want to go deeper into the details, what is CVI going to help me as an early career or anybody just graduating to get on the right track from the beginning?
Yes, I am very passionate about this, and I hope my co-directors will support this new initiative. I think just like we spend time crossing CTOs, how we have sessions here about DOACs, how we talk about TAVRs and mitral clip, we really need to have substantial and with meat sessions discussing the business of medicine. I think when we said, when I was in fellowship and early on in my career and where I trained and where I practiced, if we talked about the business of medicine, it was looked upon negatively.
Yes.
Like, listen, we are doctors, we are here to take care of patients. But the truth of the matter is that, as they say in the business school, no margin, no mission, right? Mm-hmm. If you cannot pay for the hospital, if you cannot pay salaries, and we know now, if you don't have nurses, you can't do procedures. You cannot run your hospital.
Yes.
So the truth of the matter is that it is almost putting your head in the sand if you say, oh, I'm just a physician and I don't care about the business of medicine. That mentality, that academic mentality has to change. And everyone needs to know about the business of medicine. They need to be involved in the administrative side of medicine. So we hope to have sessions that can teach that. We hope to have panels and discussions around that. We hope to have a smaller group breakout sessions that can discuss those aspects of medicine. And we also want to have abstracts like make it academic.
Yeah.
Like bring people
About
that teach us about the business and the administrative side of medicine,
Yeah.
and really make it similar to like a coronary track or an endovascular track, where people can really spend time, learn, build relationships, and also those that are interested to pursue, just like here when we meet people, people come to me because they are interested in endovascular, right?
Yes.
I want people to come to me because they're also interested in administrative side of medicine.
Yes.
I want to meet fellows that say, you know what, I want to run a hospital in the future. I want to run a heart and vascular institute. And I want to know what's the pathway. How do I get there?
Yes.
What do I need to do with my career to get to that point?
Exactly. And there's administration now, as you said, they're running the hospital. They don't have medical background.
Yes.
And we need to speak their language.
That's exactly.
So they can understand our concern and what we need. And at the same time, we understand what they want, so we can be on the same page. But I feel sometimes we butt head with administration. Oh, they're not doing what we want. Because I think we're not delivering the message right. So knowing the business aspect of it is very important.
This is very similar. We are very familiar with this. This is similar us being interventional cardiologists and understanding the language of cardiac surgeons or vascular surgeons.
Exactly.
If we don't understand CABG, if we don't know the outcomes of CABG, if we don't understand FEMPOP, if you don't understand outcome and complications of vascular surgery, you can't communicate. You're going to be discussing different languages.
Yes.
So just like as interventionalists, we need to understand those to be able to compete, to be able to communicate, to be able to build relationships.
Yeah.
We need to do the same thing. We need to understand the administrative and the business side so we can communicate, like you said,
Right.
understand their pain points. Because sometimes, I'm now on this side of the aisle, there are some things that I'm like, how come the physicians don't understand this?
Yes.
And it's really a problem.
But it took you some time to understand.
That's
it.
right.
And you
Digest
want to make sure people get on that wagon early on.
That's exactly right.
So
That's
as simple as possible. Like sometimes we ask for the ultrasound machine, extra ultrasound machine in the lab, and we struggle to get it. They want to have evaluate a case, submit a case, why we need it, and justification for it. So this is when it comes, I think, they understand and the profit of the cath lab, and they have to manage the budget and so forth.
Absolutely.
Innovation, same thing. You did a phenomenal job. I think you have today almost a 3-hour session on innovation is to find the funds, to find the people who are in the think tank,
Yes.
how to come with ideas. So there's a lot of great ideas for a physician, but they don't have no time to launch that idea.
Yes.
So I think this think tank that you created in this summit, I think is going to be very important.
Well, I mean, I think that, you know what, we are trying to address the gaps in residency and fellowship, right? You know, they don't teach you about innovation. They don't teach you about the business of medicine. They don't teach, as a matter of fact, they look negatively upon it. Many of us train in major academic centers, which in the past, now they are doing it, but in the past they never paid attention to these things.
Correct.
We just did what's right for the patient. And the truth is that the patients now care about the cost. They care about the cost of their healthcare.
Yes.
They go online and they want to see which healthcare is going to give me the best cost for the value, right?
Yes.
So in the innovation is the same. You know, tonight, for example, we have Dr. Mark Turco. As you know, he's a very prominent interventional cardiologist. He's been through it all, right? He was a physician. He was a clinical trialist. He was an interventionalist. He then became a CMO of Medtronic. And then from there, he then moved to innovation. He led innovative department at UPenn. And now he's working with the startup companies. Like, he's done it all. And I always like to bring, and we always like to bring, these kind of individuals to CVI so they can give us tips and tricks.
Yes.
If you're somebody that's interested to pursue these things, how do you do it? If you have an idea, how do you get that idea to the next level, to the next step? How do you find funding? How do you get it protected? How do you protect your IP? How do you find friends? How do you network? All of these are things that I've struggled with. And I'll be honest with you, I continue to struggle with because these are not easy.
Yeah.
Sometimes you're lucky, you're in the right place, but for most of us, we don't have that environment.
Yeah.
And we need to learn, and we're trying to leverage a meeting like this to be able to fill in the gaps
Yeah.
that we had in residency and fellowship in the areas that we could not learn or excel in.
Yeah. And as you said, CVI is the only conference that highlight this part to create a smooth pathway for innovation. Well, Mehdi, thank you so much for putting this together with the core director and focusing on innovation. Please watch these videos and other on CVI YouTube channel. This is Alraies from Denver, Colorado. Mehdi, thank you so much.
Thank you, Shadi. Thank you very much. It was a pleasure.